The numbers are startling. Research shows more than 2.5 million Americans are dependent on pain relievers known as opioids. Now, according to the National Institute on Drug Abuse, opioids include medications such as hydrocodone. An example of that would be Vicodin. Oxycodone is another opiate. Oxycontin and Percocet are examples of that. The Institute says morphine and codeine are opiates, even heroin. It's scary. Research shows addiction to opioids has tripled over a 10-year period, which is why it's considered the nation's fastest growing drug problem. Joining us today to shed some light on opioid addiction is Timothy Lepak, who's the president of the National Alliance of Advocates for Buprenorphine Treatment, and Dr. Richard Soper with the American Society of Addiction Medicine. Gentlemen, thank you so much for joining us today. First of all, help me out here.
Thank you, Jim.
Explain what an opiate is.
Jimmy, actually an opiate is a natural occurring substance. It derives from the fruit of the poppy flower. It's been around for thousands of years. It's very effective pain treatment medication. Unfortunately, the period of time that's effective gets shorter and shorter the more that is taken, and the amount that has to be taken increases, ultimately developing tolerance, as we call it, and that becomes dependency or addiction.
So, there's a new survey out that shows us who is becoming dependent on this, and I understand it's a little bit surprising. Can you tell us more about that?
Yeah, we did the survey this summer, and it was for people that were addicted to opiates. And we were kind of expecting to see some areas where there were surges, like, for example, in age groups between 20 and 30, but we didn't. As it turned out, the average age was 46.
Wow.
And the other demographics were pretty much even, spread out throughout the patient base that we surveyed. What we think is going on is that as the population ages, that more and more people are seeking treatment for chronic pain.
Yeah.
And often that's lower back pain or joint pain, and they're very often receiving opiates, and many people are becoming addicted to them.
So something that was initially designed to help is actually hurting.
It's hurting some people. I mean, it's helping many more than it's hurting. What happens is when the medication is taken in absence of the pain to offset it, because what the opiates do is they give you a flood of feel-good chemicals.
Right.
And if there isn't pain there to offset that, then you get a rush of euphoria that the body's not really equipped to handle. And it misinterprets this as something that's necessary for survival, and then craves it, and eventually it starts down the addiction path.
Okay. So is there something that will stand out to me, say, if maybe it's me, maybe it's someone I love, is there something that will tell me there's an active addiction going on to opioids?
That's a great question, Jimmy. And if you're not a healthcare professional, I think that to become an assessor or to make that assessment might be difficult, but some of the cues or the early signs can be change in behavior, rapid or unstable mood swings, change in friends that someone has previously been associating with, significant change in financial stability, change possibly in employment, change all of a sudden in other family members that might have prescription medication in the household are disappearing. And those can be cues towards leading to have to find a physician or someone in healthcare that can help screen that individual and provide care. It is a family disorder, not a single individual. The family is a critical unit in providing care.
So you're telling me that opioid addiction can be treated?
Yes, it can, and one of the ways to do that is going to treatmentmatch.org or contacting your local physician or pharmacist or some other licensed healthcare provider to help link you with individuals that can provide that care.
All right. Mr. Lepak, Dr. Soper, thank you so much for your time this afternoon with an incredibly difficult topic. If you'd like to read more about opioid addiction, including information on how you can get help for yourself or a loved one, go to WBOC.com and click on our picture at the top of the page. Now, you heard Dr. Soper mention how important it is to reach out for help if you or a loved one is dealing with an opioid addiction. Did you know there are many places here on Delmarva that can provide treatment? Hudson Health Services in Salisbury is one of them. They help those with alcohol and drug dependencies. There's also the Eastern Shore Community Services Board in Nassauwatuck if you're looking for help near Accomack County. Aquila of Delaware in Georgetown is another option. The agency says it's dedicated to treating substance abusing, dually diagnosed adolescents, young adults, and their families. In Kent County, Delaware, Connections Community Support Programs help with opioid addiction, including other substance abuse problems. We have a link for more information on these centers that can help you. Just go to WBOC.com and click on our picture at the top of the page. Okay, now let's talk about avoiding disease. Getting vaccinated can help with that. Up next, we hear about a measles outbreak in a bustling theme park, plus how you can protect your family. And it appears that more and more potentially deadly diseases like measles are making a comeback. Parents are debating to vaccinate or not to vaccinate. You hear both sides of the debate next. And there's no downside to helping spread the word on such diseases. Up next, we hear from world-renowned photographer Ann Geddes on her new project aimed at saving lives. But first, we're focusing a lot on health today. Dr. Oz says getting enough shut-eye is vital.
Hi, I'm Dr. Oz. If you're tossing and turning at night, worrying about it will only make things worse. Fretting over lost Z's revs up your brain, keeps your sleep at bay, and also decreases your sleep quality once you do finally drift off. The first step to stop stress? Turn the clock around. Watching the minutes tick away will only up your anxiety.